Okay. So, thank you, Elizabeth Benjamin, for sitting down with us from Community Service Society of New York.
Well, I'm delighted to be here with you.
So, just to get started, how long has CSS partnered with HAP?
Well, at least 4 years, although I feel that, off and on for decades, I'm sure we've worked together, but I know most immediately we really ramped up our partnership around the enactment of the Affordable Care Act and getting it implemented in New York State.
Of course. And since then, what is something in particular that you guys have worked on that you've been particularly proud of?
Well, the standout thing was when we were rolling out the Affordable Care Act in New York State, it was really a crazy time. We had just barely convinced the governor to issue this executive order to set up our marketplace. The state was amazing. I mean, our state officials were able to prop up a marketplace in a mere 13 months, which was sort of extraordinary,
right,
given that all the other states had several years and the federal government had I think, 3 years, kind of jumpstart on us. So that was great, but of course the state officials were just like, oh my God, is it gonna work? Well, the computers work on October 1st when they turn it on, and that was a big question mark. And so they were full on doing that. And so the Community Service Society and Healthcare for All New York, which is the big statewide consumer advocacy campaign with 170 groups, all consumer groups from around the states, all came together and said, we've got to do some outreach here. We've got to explain to people what's going to happen. And so we came together with HAP, Community Service Society, Healthcare for All New York, and decided to pull together a convening or a series of convenings in 7-8 regions around the state to sort of tell people what's going to happen and to bring all the stakeholders together. And we invited the state to come, and they participated. At first they weren't really sure if they wanted to participate with these scruffy types, but thanks to HEP and their contacts, they were like, oh yeah, we really do want to do this. And they got really excited about it, and CSS was really excited, and the consumer groups and the health insurance companies were excited, and all the navigator groups were excited, and the hospitals and providers, and everybody came together, and we had these amazing enrollment summits throughout the state, and we've basically done that for 3 or 4 years now.
I was going to say, it's been very successful, and so that brings me to my next question. Now we're kind of on the flip side, and HEP is working again with CSS, but now it's
defense.
For something much less,
Yeah. No, I mean, it's very, I think, unsettling for those of us who've worked so hard since 2010 to see coverage, affordable quality coverage, be a reality for most, residents of New York State. And I think what's particularly special about New York State is that, again, with all the stakeholders' agreements, even undocumented immigrants or people with not, perfect immigration status are able to access some kind of form of coverage through the New York State Health Marketplace. So we've really been able to make coverage, affordable coverage, an option for many, many, many millions of people and who have come through our marketplace. And I think it is very sad to see even some New York State elected officials decide that ACA isn't working. And, we're all like, where? I mean, not in Ulster County. It's working great in Ulster County. Not in Buffalo. It's working great in Buffalo. Long Island. It's in New York City. It's working great. I mean, we're lucky that some of our elected officials did realize that, yeah, it's working great and are really vigorously defending it. And others need some more education and some more assistance trying to understand how much this means, how important this is, and how meaningful it is for their constituents. And that's where, CSS is able to generate those stories. We serve over 100,000 people throughout New York every year, so we're able to generate stories. HEP is able to help bring the considerable economic weight of hospitals and unions in various local areas to do that kind of public education and make sure that the community is aware of how important the ACA, both economically for the local regions, but also more importantly, from my perspective, of course, for the people that are actually enrolling and getting coverage.
Of course. Yeah. So obviously the ACA is overshadowing everything, but could you tell me, in your opinion, what is one of the most important healthcare issues facing New Yorkers
right now?
Yes.
Oh, I mean, everything's all about what's going to happen in Washington. So from our perspective, there's, really three terrifying things happening all at once. Number one, with the uncertainty about the cost sharing reductions and health, it's really affecting health insurance premiums. And so we don't have the filings up publicly yet, but we're seeing some insurance companies claim 30% rate increases, other claim they want to have 7% rate increases. So there's a range already out there, but it's a lot of mystery because it hasn't been posted yet. But already there's uncertainty about what the rate increases will be next year. Our organization, Healthcare for All New York, our advocacy organization that we work with, this 170 coalition, we're going to be looking at those rates very carefully and trying to do a good job in assessing what's right, what's not right. The second, but more importantly, all of that's happening because of the chaos in Washington.
Of course.
And so that's very concerning. I think the most important thing from our consumers' perspective really is sort of divided between the essential plan and Medicaid cuts, and potential cuts to both those programs. The essential plan offers health, affordable quality health insurance to at least 665,000 people. That's the last public figure, but we think it's kind of inched up to like the 700,000 range, and that's a great deal for New York because we get an extraordinary amount of federal financing to really offer a great and affordable commercial health insurance product to people that are not eligible for Medicaid but who have modest incomes. And then I think last but certainly not least is the Medicaid, the possible Medicaid cuts, and whether you call them caps or block grants, they're cuts, and they're going to hurt people. And they're not just going to hurt the expansion population; they're going to hurt kids and seniors and everybody, and they're going to hurt providers and unions, and so that's just, I think, terrifying. And we're really hoping that Washington will be Washington and just come to an impasse and forget it, do over, and actually try to figure out some meaningful reforms we could do together that would be really smart. I think everybody agrees that there should be better market stabilization rules, better risk adjustment, reinsurance programs, risk corridor programs. There's really smart things we can do for not a lot of money that would really stabilize insurance markets in America. And that's what we should be doing. That actually are, really very free market, private enterprise solutions that I think everybody could agree with if they could all just take off their political hats and just sit down and talk about how we can fix this thing. Right.
Well, I think, HEP has really enjoyed working with CSS on trying to get the message out of what actually will happen if AHCA is passed today in its current form. I think that's, obviously, I'm sure you agree, something we're going to need to really work on going forward. How else do you see CSS and HEP partnering in the future?
I think two ways. It's sort of there's a fork in the road, right? If we do have AHCA, then I think we're going to have to really figure out a way to partner together to save the essential plan and to really think through what does insurance coverage look like for moderate and low-income people. So the vulnerable populations, of course, but then I think we all can agree that we can do more than just the Medicaid level of people. We're not going back to where Medicaid levels are at 87% of poverty, right? No, we have to, which is, what is that, around $10,000 a year, $8,000 a year, right? It's low. So I think we really need to, and I hope that we would work on trying to figure out a coverage solution for everybody that's below, maybe ideally $36,000 or $40,000 a year, but even $24,000 a year, for modest, low-wage workers, including some 1199 members, but also restaurant workers and daycare workers and home care attendants, there's a whole spectrum of low-wage workers that we really should be stepping up and doing something for. And then I think if everything comes up roses and the ACA survives, then I think we really look forward to working with HEP on trying to figure out a more proactive agenda. We have a lot of young adults, dreamers, we call them, who have sort of kind of an immigration status. They're up to age 30. We already provide Child Help Plus to undocumented immigrants who are below the age of 19, the kids. Let's look into expanding Child Help Plus to young people up to 30. We already let young people up to 30 join their parents' plans, and who have parents who have working who have working commercial insurance through their jobs. Let's do something for like that for the immigrants who can't access their parents' coverage. Let's try to think of an ambitious agenda that really makes New York retain its status as first in the nation in the Child Health Plus program. We were the first in the nation to do a really good Child Health Plus program, and let's build on that thing and let's make it better.
I was going to that was going to be my last little bit more wonky question was after we had the dramatic Child Health Plus expansion 10 years ago now. Do you see that as something that's particularly in jeopardy, or is that something that we're not as concerned about as some of the more impending?
Honestly, kids are really cheap to cover, and that just didn't cost that much. So I don't. That's not the one I'm worried about. I'm actually more worried about the essential plan. First of all, there's only 300,000 people in CHIP. I don't think the federal. I think even this Congress isn't likely to say no more states' children health insurance program. This is Orrin Hatch's baby, and he's still there.
Yeah.
So I don't think Senator Hatch is going to just wake up and say, I don't want children's health insurance anymore. That just doesn't seem likely.
That lets us, look towards hopefully expanding it.
Yeah, I think that's what I'd like to see.
Great. Well, thank you so much. This has been a pleasure.
It was great to work with you guys. Thank you for interviewing me.
Great.
Okay.
Is that good?